Good evening, good afternoon, and good morning. This is the 1397th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. RAMYA GIRISH from Qatar. Let us begin the session with 1 minute silent prayer. Thank you all. All of you know that International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and homeopathic doctors. And we have 3 sessions every day. Just we completed our Hindi session that began from 7 to 8, and now 8 to 9 we have the international session in English, and 9 to 10 the local language session in Malayalam. And today we got a guest from Qatar, Dr. RAMYA GIRISH. She has completed her MD in repertory from Bharat Homeopathic Medical College after completing her BHMS from Government Homeopathic Medical College, Bangalore. She is the chief physician at Giri Homeopathic Clinic in Bangalore and currently stays. She has more than 8 years of clinical experience, and today Dr. Ramya will be discussing about homeopathy in dysmenorrhea. As you all know that this is a very common condition that happens with women, and so we as homeopathic doctors have a solution to all these things of the women, but unfortunately still people are not aware about this thing. That's the reason why the International Forum for Promoting Homeopathy is bringing such presentations and publishing in the same on the very next day to the YouTube, so that more and more people will be able to understand what is happening with the homeopathy in the present days. So we welcome all to this session, and particularly I proudly welcome Dr. RAMYA GIRISH to the session. Welcome, doctor. You can begin the session. Your co-host, you can share. No, unfortunately, yes. Yes, now you are co-host. You can share.
Thank you for the warm welcome. I thank you, one and all, for giving this opportunity.
A little more sound, please. Little.
Yeah, can you hear now?
Yes. Please wait 1 minute. I want to unmute all before that, so that you can. Yes, now you may go ahead with it. Please unmute yourself and.
Yes, sir. Is it audible now?
Yes.
Can I share the screen?
Yes. If it is a little more louder, that's good.
Okay, sir. Okay.
Okay, now it is okay. You can share the screen.
Is it visible?
Yes, everything fine. Little bit of cloud in your face. Little bit of cloud in your face because the room is a little bit dark. Otherwise, everything is fine. We can see the introduction.
You can see it, sir?
Yes.
Dysmenorrhea generally means painful menstruation. The more realistic and practical definition includes the case of painful menses, so as to incapacitate the day-to-day activities will be less due to the pain. It is one of the leading cause of short-term school absence in adolescent girls and common problem in women of reproductive age.
Can you say a little more louder?
Yes, sir. Yes, sir.
Otherwise, you can sit very little more closer to the.
Okay, sir.
Some people are
two types of dysmenorrhea, the primary dysmenorrhea and secondary dysmenorrhea. In primary dysmenorrhea, that refers to there is no identifiable pelvic pathology here. Whereas in secondary dysmenorrhea, there is pelvic pathology. The primary dysmenorrhea, it is usually seen in the age group from in the adolescent age group. That is after menarche, 6 to 24 months after menarche it is seen. Whereas in secondary dysmenorrhea, it is commonly seen in 30s or 40s age group. There are three types of pain here in dysmenorrhea: congestive, spasmodic, and membranous. In congestive type of pain, the premenstrual pain is either at the back or of the lower abdomen. It occurs 3 to 5 days before the onset of menses, and it is relieved by menstrual flow. Whereas in spasmodic, it starts on the first day of the menses, and it lasts for a short time. There is associated symptoms along with this, like collapse, nausea, vomiting, and the pain does not persist for more than 12 hours. Whereas in membranous, there is passage of membranes. The shreds of the endometrium is seen. The prognosis of the case here is poor. The risk factors associated with dysmenorrhea are the duration of menstrual flow. If the flow is for a longer duration, there is increased risk. And due to smoking, caffeine consumption, obesity, and the alcohol consumption, and the high levels of stress causes great increase of incidence in dysmenorrhea. The etiology. What is the cause? The cause for dysmenorrhea is, it is still under the research. The time of menses is believed to be due to the production of prostaglandins in the endometrium in an ovulatory cycle. There are some reports that indicate the levels of prostaglandin measured in menstrual fluid. Increased secretion of prostaglandin, it causes myometrial contraction, that is contraction of the uterine muscles, that leads to uterine ischemia. That causes hypersensitivity of the pain fibers, and in turn causes the pelvic pain. The clinical features. The main clinical features are seen. The pain begins few hours before or just with the onset of menses. The pain usually lasts for few hours, may extend to for 24 or 48 hours, not more than that. The pain is spasmodic, means it comes in between and goes, and it is confined to lower abdomen. It may radiate to the back and medial aspect of the thighs. The other symptoms associated with this are nausea, vomiting, fatigue, diarrhea, headache, and tachycardia may be seen. The examination and investigations here are: abdominal or pelvic examination does not reveal any abnormal findings. For any detection of abnormality, usually ultrasound of the pelvis is done, which is non-invasive. Management. Coming to the management part, the general measures include improvement in the nutritional state, the dietary changes, regular exercise should be done, and the reassurance, counseling, and psychotherapy. All these are given as a management. Lifestyle changes, mainly exercise should be done to ensure sound sleep. For at least 6 to 8 hours of sleep is necessary. Avoid smoking and alcohol. Reduce the caffeine intake. Diet, eat healthy and fresh foods. Avoid dairy products like milk, cream, cheese, and have more of fresh fruits in the diet, like plums, apples, dark grapes, pomegranates, and green leafy vegetables should be included in the diet. The main thing is avoid stress and tension. Due to lack of sleep, all these symptoms will be adverse. Yoga activities can help to reduce and prevent severity of many ailments. Vipassanas, these are the most convenient, drugless, and inexpensive method of treatment. It is found to have the encouraging effect in reducing the pain during menses. So, yoga is advised for the female. Now, coming to the miasmatic approach, SORA is seen mainly in the background. Like all psychopathic perversions, functional disturbances, SORA is seen. In psychosis, endometrium, gluten appendages, where inflammatory process is seen, mainly in the tube, fallopian tubes and the ovaries, if there is any disorder, psychosis. Tubercular, mainly of pathological disturbances. Under SORA, the discharge will be blank, clots, and scanty discharge of the menses. Whereas in psychosis, acrid excoriating discharges are seen. In tubercular, bright red blood, sometimes associated with vertigo, fainting, pallor of the face are seen. Miasmatic background in dysmenorrhea, SORA at a very early at puberty and under climactic period, it's active. Psychosis, offensive, clotted, stringy, large, dark, even black discharge are seen, folicular pain, spasmodic in nature. Tubercular, prolonged and copious flow. Coming to the repertorial approach, Ken's repertory, you can find dysmenorrhea under genitalia, menses painful, dysmenorrhea. In Bowman Wilson's therapeutic pocketbook, you can find it under sexual organs, female organs in general, spasmodic, menstruation under membranous. In Boger Bowman Wilson's characteristics and repertory, under menstruation chapter, membranous. In Clark's repertory, dysmania or dysmenorrhea. In Borik's repertory, dysmenorrhea in general. In Murphy's repertory, dysmenorrhea, painful menses. In Fatak's repertory, menses painful under dysmenorrhea. These are the places where you can search for dysmenorrhea in the other different kinds of repertories. Case 1, patient came on May 5th. She was aged about 40 years, married, and she was a housewife. She presented with the following complaints. First was the pain in the low back before menses since 7 months. The location was pain from low back extending to right and left iliac region. The sensation of pain was throbbing, aggravated by lying down, walking, sitting. And she was better as the menses subsides. The patient was feeling better. There was no associated symptoms, no concomitants in this case. The history of presenting illness was the patient was apparently normal previously and gradually started with low back pain, which extends to the iliac region on both the sides. During menses, the pain is severe and persists for 4 days and subsides as the menses stops. The pain usually subsides. The present menstrual history was regular, cycles were regular, in the interval of 26 to 27 years. Color of the blood was bright red, non-offensive. Pain was present during the menses. The character was throbbing pain 4 days before the menses. There was no intermenstrual discharge. See. Past menstrual history, menarche at the age of 12 years, and the cycles were regular and nothing significant. Pain was present. Past history of the case, the patient suffered from typhoid at the age of 10 years, and she was hospitalized for a month, and she was pregnant. Family history, father died due to epileptic attack at the age of 65. Mother died due to complication of diabetes. Elder sisters underwent hysterectomy. Personal history, everything was normal, nothing significant. Menarche at the age of 12 years. The changes were seen in the menses, it was after pregnancy. Pain during menses were present. She had 2 deliveries, full-term normal hospital delivery. The physical general, first normal, craving for spicy food, aversion to sweet, and she was a heart patient. The mental symptoms here are roots and weeps about her mother's death, weeps when alone, introvert, and does not get angered easily. She feels better by consolation. Consolation, she feels better. In the general examination, everything was normal. BP pulse, all our vitals were normal. Systemic examination is also normal. Lab investigation, they were advised for blood roping and ultrasound of pelvis. Diagnosis, it comes in the secondary dysmenorrhea. The symptoms are mainly of functional like pain in low back, pain during menses, weeping, brooding, all these in miasmatic analysis, it comes under SORA. The evaluation of symptoms, these were the symptoms taken for evaluation of the case. Broods and weeps along, introvert, consolation feels better, desire spicy, aversion sweet, sleep disturbed heart patient, tongue moist, particulars, pain in low back before menses. After repertorization, all these three drugs were seen. Sulfur, pulse, and natriumate. Sulfur covered 17 points out of 8 symptoms. Pulsatilla 17 for 7. Natriumate for 17 for 7. The first prescription given was Pulsatilla based on the constitution. Pulsatilla 1 BD 3 days was given, followed by PL. Then follow after a month, the symptoms, the pain in the low back during menses were better. And on 15/7, the pain during menses better. The back pain was also better, the patient said. And the PL was continuing for 7 days. The patient was under observation for 6 months. She was better with homeopathic treatment. Advised for regular visit. If symptoms recurred, she was advised to come. Case 2. A 27-year-old unmarried female belonging to middle socioeconomic status started complaining of lower abdomen pain thighs before and during menses since menarche. Menarche was at the age of 11 years, but since last few months, the pain increased. She used to take painkillers during the first 3 days of the menses. She could not do a regular activity. She could not go to office during the first 3 days of menses. The character of pain was spasmodic. Pain was ameliorated only by balm application, like hot water bath and taking rest. Past history, she had difficulty in breathing in 2010. She used inhalers and took steroids for the same complaint for 1 year. After the suppression of respiratory complaints, she developed urticarial rashes all over the body. And she was treated with allopathic for the same. The physical generals, patient used to take extra salt in the food. She had unrefreshing sleep. Sleep was not continuous, and it was disturbed. She was a heart patient. Mentals, she did not like company. She was responsible and took responsibility seriously. She used to say that she was different from other girls. Whenever she was upset, she did not like consolation. Consolation, aggravation. This was seen in this case. Analysis of mind, all the mental symptoms were taken. Physical thirstless with dryness of tongue. She used to take extra salt, hot patient, unrefreshing sleep. Particulars, spasmodic pain before and during menses. Painful menses ameliorated by warm application. When the menses were regular, dry red, no clots, no intermenstrual discharge, slow for 3 to 5 days at an interval of 28 days. Evaluation of the case was done. All the symptoms were taken into consideration. Repertorial analysis, after repertorization by Kent's method, we got natramine 22 for 10 points. 10 symptoms were covered. Calcarea carb 11 points for 8 symptoms. Pulsatilla, sepia, and platina, these were seen. The first prescription done was natramine was selected as constitutional medicine. 200 single dose was prescribed, and magnesium phosphoric 33 doses SOS along with PL was given. This was the first prescription given on 10th of September. Follow up, she came on 28th. She had her last menstrual period. She did not take any painkillers but took Macfos. Pain was better by 30% compared to previous cycle. On 26/10, no pain during menses and feeling better in all complaints. But her previous respiratory complaints reappeared. PL was given for a week. On 18/11, no articular rashes and other complaints. She was better. Patient was feeling better. The Rudram 30 for a month was continued. Patient was under observation for a year and advised her to report in case of remission of complaints. This case shows the effective role of homeopathy in the treatment of primary dysmenorrhea. Now, coming to the homeopathic management, we have many drugs that comes under dysmenorrhea. The simicifluga. Here, the patient complains of pain in lower abdomen, usually starts on the first day of the menses. Pain persists until the flow ceases. The characteristic indication of this remedy is the pain is flying. Flying pains are seen from pelvic region from one side to the other region. In lecasis, it is mainly given in climacteric age. The women who have intense discomfort and tension before the menstrual period and feel better when the flow is established. The symptoms are bearing down sensation in the pelvis, flushes of heat, headache, inability to tolerate the touch of clothing around the waist or neck. This is the PQRS symptoms in lecasis. Vivian tigrinum, here it is given for great premenstrual irritability and cramping pain with bearing down feeling during the periods. The woman feels that the uterus is pushing out and may need to sit a lot or cross her legs so that she feels better. Likely to feel worse from strong emotion or excitement and better from fresh air. Calcarea carb, it is given to safe, fatty, flabby person, strong inclination to obesity. Here the patient suffers with headache, cold chilliness, euphoria before menses. During menses, there is cutting pain in the uterus. The cause is little exertion or excitement, it causes dysmenorrhea. Menses started at early age, but too early, glass lock and flow is profuse. There is infertility with copious menses. There is lot of discharge here. In Naxvomica, the menses is too early, profuse and long lasting. Whereas in Sabina, it is too early, too profuse. It is bright red, dark and coagulated. Drawing pains is seen in the lumbar vertebra, extending through the pubis. Natramine, it is too late, too scanty, too short duration. Menses is too early and too profuse. It can be given to both the primary effect, shortening of the menses. Secondary effect is extension of the menses. It is given in both the cases. Kalicarb, difficult first menstruation. Menses suppressed with anasaka or dropsy. It is in backache before and during menses. Sepia, here the menses is painful, late or suppressed, with the feeling that the pelvic floor is weak and if the uterus is sagging, like feeling everywhere. The woman feels irritable, dragged out and sad. Macfos, menstrual colic, pains radiating from spine during or preceding flow. Vaginismus is there, ovarian neuralgia, aggravation on the right side. The patient is better by external application of heat. Folosing, Several days before menses, there is sharp, darting, paroxysmal pain in the uterine region, makes the patient bending her double by pressing on the painful part and warm. Left ovarian neuralgia is seen in follow-up. Pulsatility also, the patient feel better by bending double. There is uterine cramp, fainting during menses, nausea and vomiting. Whereas in many lotus, the menses is painful and difficult with nervous headache. Nervous headache is seen in many lotus. There is sharp, shooting and sticking pain seen in external genitals. Varatam viridae, terrible dysmenorrhea for several days before the appearance of menses, pain extending all over the body, pulsations in the head is seen. Phenomena is given to the moody person, anger and irritability are seen. The menstrual flow is heavy and the blood may look dark, clotted. It extends from the pelvic area to the thighs and aggravation at night. Phenomena aggravation at night is seen. Polyphylum, there is spasmodic and severe pains flying in all directions. Dysmenorrhea also spasmodic pain, a spasm of stomach with dyspepsia. That is indigestion is seen. And xanthosylum, there is agonizing bearing down pain, backache as if broken. The pain starts in the iliac crest and shooting down into knees with no relief in any position. Viburnum opinus, there is sudden pain in the region of uterus before menses and much backache during menses. Spasmodic dysuria in historical subject calls for viburnum. Belladonna is one of the main remedy. It is given an intensely painful, sudden onset. Vagina is hot and dry, and the pains are cutting through the pelvis in a horizontal direction, not around the body as in platinum and sepia. The above therapeutics are used frequently in dysmenorrhea with good results. Other individualized homeopathic medicines minimum can be used, and significant relief for the patients can be given in case of dysmenorrhea. These were the references taken from the textbook and the websites. Any questions? Any questions? Sir, is it?
Thank you. Yes, can you hear me?
Yes, sir, I can hear you.
Yes, unfortunately, I was muted.
Okay, sir.
Okay. Anyway, it's really a brilliant session. Even though you presented only 2 cases, those cases were really good. And that shows the beauty of homeopathy and how a homeopathic doctor need to look into all these aspects before concluding the case, and then how to repertorize the case and how to find the remedy, and how the remedy works after taking after the patient took the medicine. And once it works beautifully, that's the reason why after you observe the patient, first patient for about 6 months, and there was no recurrence,
Recurrence of the
then
symptoms.
naturally, then we can tell the patient that you can stop the medicine. And once the patient is able to stop the medicine, then that patient will tell to all people around the world, around her, that homeopathy works in her. This is
Yes.
what every doctor has to do. We never ask the patient to continue. You may continue the medicine for some more years like that. That's what happens with the other system. where people are addicted to take medicine and they continuously take medicine. And in the second case also, that medicine works, and that's the reason why they got the medicine. Usually, the almost all melancholic remedies, particularly Ignatia, Pulsatlan, Netromor, Graphitis, Sepia, all these remedies have a role in this dysmenorrhea and even in metrorrhagia or menorrhagia, whatever may be the condition. If the case is a full case, definitely the medicine works. And of course, there are certain reasons behind all these things, and that need to be corrected. Sometimes it may be the food habit or something like that, or sometimes the pressure that the patient undertook during her life from the menarche itself. So, what's your opinion on all those things, doctor?
The thing is, mainly constitutional medicine should be given to the case, taking moral consideration, and along with that, counseling should be done. Counseling should be given
Of course,
regarding
my question is, what's the role of these food habit? Because if the patient is not taking proper vegetable diet, or that means that he or she may be taking lot of non-vegetarian diet, but she is not interested or not like to take the vegetarian diet and fruits. So but it is better to advise the patient to take some more quantity of vegetables and fruits, as well as whether you advise the patient to do some kind of exercise when there is no menstruation.
Yes, sir, of course, diet plays a very important role in dysmenorrhea. Not only dysmenorrhea, but diet is a must. They have to advise fresh fruits, vegetables, along with contains natural vitamins, minerals, and proteins to the patient. And also yogasanas mainly. Exercise they have to follow, regular exercise they have to do. Along with yogasanas, few asanas are mainly given to the females who are suffering with dysmenorrhea and menstrual troubles. They'll be better with that. So
Okay, that's
yogasanas
good.
is mainly advised.
Yes, definitely. Yoga has a role to play but in women's life, not only in women's, but everybody's life.
Generally,
But yoga can do wonders with women in this those who are suffer from this kind of diseases.
yes, sir, true.
It's if anyone want to have a question, or anyone want to speak about to Dr. Ramya, please raise your hand. I think Dr. Rambaresh sir is always there to ask the question or ask to appreciate her for this presentation.
Thank you. Thank you, Dhaneji, and congratulations, Dr. Ramya Girish.
Thank you, sir.
Very, very thanks. Very nice presentation.
Thank you, sir.
Excellent session. Dysmenorrhea case. Presentation is very good. Beautiful describe the presentation case. Dysmenorrhea due to lifestyle, cause of lifestyle. Dysmenorrhea, many medicine to deal Camemula, Calcarea Phos, Pulsatilla, Netramuritici. During men's period, main cause of dysmenorrhea and men's trouble, during men's period, cold bathing suppressed men's due to many kinds of problem, pain and abdomen, discontinue of menstrual trouble. During men's 2 and 3 days, not bathing head and abdomen, cold water. The best lifestyle, best habit every 40 years. 40 years. Very, very thanks, Dr. Ramya Girish. Many kinds of medicine during cold bathing, Xanthozylum, Sensio, Cuprum metallicum. It is a Calcarea Phos is the best medicine. So very, very thanks, Dr. Ramya.
Thank you, sir. Thank you.
And now I invite Dr. Ramadevi Ambadi to say a few words on this presentation. She is an expert in this field and she has more than 2,000 successful cases of infertility in her kitty. And Dr. Ambadi, madam, are you there?
Can you hear me?
Yes, yes.
Dr. Ramya, it's a very nice presentation. And see, we had gone through all the symptoms. Then, in some cases, if the flow is more, usually the pain will be reduced. But in actia resinosa, if the flow is more, the pain also will be there. That's special. It is an uncommon symptom. Then we can very well select the medicine and we will get good result. Like that, in lilium tick, if they are walking, the pain will be reduced and flow also will be reduced. And if they are sitting quiet, the pain will be increased and the flow also will be less. Like that, we can very well distinguish the medicine. Anyhow, so very nice presentation, Ramya. Keep it up and come again.
Thank
Okay.
you.
And now I invite Dr. Jose Isaac sir to say a few words on this presentation. Jose Isaac sir.
Actually, I did not hear from the beginning. That's why I did not want to. But she almost presented all the main remedies. And actually, there are in a way a step-by-step way of dealing with this problem. In many cases of dysmenorrhea also, we have a step-by-step. That means there are certain acute remedies which help in the very acute phase. Then after that, we have to go to the next level, more deeper acting remedies. And the relationship of remedies is very important in this type of cases, because we may not be able to go through or only with one remedy from beginning to end. So many cases like when we give belladonna for dysmenorrhea, it should be followed with the calcareous tuberculinum, such remedies. So that helps. Even the emotional aspects are very important. Also, we know that after simcifuga, natramor works very well, because among the 10 or 15 remedies that we consider in such cases, there are remedies which are more better or which works better in the acute condition. And for a complete cure, we have to go to the miasmatic constitutional remedies. So in many cases, what we see is this step-by-step way of prescription. And finally, a cure is possible only with the miasmatic or constitutional remedies. So that even some cases of like our tinctures, mother tinctures and all, it doesn't give a complete permanent cure many times. Only when we go to the miasmatic and constitutional remedies, only we get a complete cure. So this is all what I wanted to add. Thank you.
Thank you, Jose sir, for your comments here. I just added some of the points also. And Dr. Ramya, do you want to say anything more? What's your opinion on young girls who are just having their menarche and having this much of pain? How will you manage?
The thing is, first is they should not think the pain it is normal. It is a normal physiological problem. So first they have to approach a physician for this. Go to the doctor first, then tell all your symptoms. And then they also need counseling. Along with the medication, counseling is a must. And the doctor will treat accordingly and advise the diet, exercise. Along with the medicines, all these are advised. In case, if necessary, investigations will be done. Reassurance is also a must in all the cases.
Exactly, that's what we require, because we need to educate our children in such a way that these things will happen, will occur in some for 10, 9 years. Nowadays, a lot of children are having the menarche even at the age
Very
of
early age.
9. And that so they don't have an idea about this. So we will have to educate them from very early childhood itself. Otherwise, they may be frightened, and then because of the once they get frightened, always they may afraid of this thing in the future also. So, as you rightly point out, we require this counseling also. That all of us are doing. Most of the doctors are also doing, because most of the homeopathy case taking itself is a beautiful one. And that is, some people believe that, oh, this doctor is giving counseling to me or my child. Actually, we are taking the case. When you go into the depth of the case, person may feel that, oh, it's a kind of counseling that's going on here. Am I
Yes.
right or not?
Yes, sir. Yes, sir. True.
Yeah. That now you are having online practice.
Yes, sir. I'm doing online consultation.
Because since Qatar is whether you are having
They
patients
started issuing license, sir. Few
oh,
are
you got the license in Qatar.
Yeah, no, few doctors are getting. Now they have started.
Okay, so that you
I
can
think
practice.
full-fledged it will be started shortly. So that
Okay.
all of us can practice.
What is the scope of homeopathy in Qatar?
Now it is started, sir, recently.
Recently only.
About a week.
About
so,
a week.
Yeah.
So you people will have an opportunity.
Yes, sir. Yes, sir. Definitely.
Whether they undertook any test there.
Yes, sir. We have to give a prometric test here.
Already it is over?
No, sir. They're starting now.
They are preparing.
There are about 100 homeopaths here in Qatar. So all are eagerly waiting for this.
Is there any governing body for homeopathy there?
Yes, sir. We have a separate license for this, QCHP license.
Okay. That's
For
good.
all the health practitioners, there is a different governing
A
body.
lot of our doctors get very good practice in the latest part.
Lot of people will be benefited from this.
Yeah, definitely, and not only doctors but also the patients.
Patients.
Because they know that their homeopathy doctors are doing something, but they have to feel it.
Yes, sir.
Okay. If anybody want to speak anything, you can come open up. I think Jawsai sir can add something more about the scope of homeopathy in Gulf and how it can be done and what are the problems facing. Yes, sir.
No, I'm not much connected with the Gulf, but generally what I know is, see, slowly, one by one, all the Gulf countries are recognizing homeopathy and opening up a new avenues for homeopathy. So actually, already there are many homeopaths who are practicing under the table and over the table in a way because of these restrictions in certain countries. But still, what I feel is, even I met a doctor in Canada. She is practicing in Qatar. Once in a while, she goes there and see patients. And also, many people are now practicing through, online practice. So it is not a problem now. Everywhere homeopathy is coming up. Mostly online practice is going on wherever there is no doctors. In countries where there is no doctors, also people are getting homeopathic treatment. And in many countries, the medicines are available now, or through Amazon or Flipkart or anything, you can get the medicine anywhere in the world now. So it has changed even actually it started with the COVID in a way, when many people turned to online practice. So I think within a few years, all the Gulf countries will be having homeopathic doctors, especially from India, mainly because more Indians are there. So that's also one of the reasons. And the Indian homeopathy is much ahead of the homeopathy in many other countries.
Yes, a lot of Pakistani doctors are also there.
Yeah, Pakistan, Bangladesh.
Dr. Ramya, what is the availability of homeopathic medicine there?
Medicines, they're yet to arrive, sir. They're waiting for the medicines to arrive.
Okay.
They've issued the license. They're waiting for the medicines.
The big pharmas are trying to.
Yeah, they're trying.
Is
If
there
once
any
started-
seminar? Is there any seminar in Qatar? I connected with homeopathy by any pharmacy?
Yet to start, sir. They're yet to do. They're
Okay.
planning in future. They're yet to start.
Okay, that's so we can propagate homeopathy in that part of the world also
Yes, sir.
in a good way. Because people like you can do a lot of things because you're practicing in a classical method, and only those people who are doing such practice are allowed in their countries.
Yes, sir.
So that's a very good move from your part also.
Yes, sir.
Then, what kind of patients you are treating? Only female cases, or you're having all varieties of patients?
Varieties are all acute, chronic, all varieties of cases. Mainly like psoriasis, chronic rheumatism, allergic rhinitis, and few children cases. All are same.
What about uterine fibroid and so?
Yes, sir. Uterine fibroid. Those are also treated. And infertility cases.
You are documenting all those cases in your.
Yes, sir. Yes, sir.
That's the need. Not only document, you have to publish it also.
Yes, sir.
Then only people will not. You can try to write articles in different papers as well as in news, even in online channels.
Yes, sir.
Online media, you can utilize online media for all those,
Yes, sir. Definitely,
so
sir.
that more and more patients will come to homeopathy.
Yes, sir.
We need a team for that, and that's what the International Forum for Promoting Homeopathy is doing. And that's why we are nowadays we are uploading every video in the very next day itself, so that those who miss can watch again. And not only that, those from the students' perspective, they can watch and study the case, each and every case in a different way, because all doctors have their own style. But the common thing is that homeopathy come to the same mode of presentation, as well as the same mode of prescriptions come out.
Yes, sir. It is definitely helpful for all the doctors because
Yes.
it is seen in YouTube.
Not only that, not only for the doctors, but also for the public also, because some public have started watching our YouTube channels, and they are able to understand what is happening with homeopathy. Or some people may get they never have such an idea that homeopathy doctors can do this much of thing in infertility, or even in this dysmenorrhea, or in fibroid cases.
Yes, sir.
Even vitiligo cases, lot of presentations were there in our forum, and all those cases were really excellent. But even learning disability, one of the area where homeopathic doctors are doing excellent work.
Yes, sir. Even in autism, ADHD,
Yes,
dyslexia, all the cases are treated well in homeopathy.
yes. So when people search for autism in homeopathy, then definitely our video may come out, and they may watch, and they may surprised to see, oh, this kind of changes can happen with homeopathy.
Yes, sir.
Right? Justice sir, what's your opinion on all these things? Ram Parisar sir, do you want to say anything more? Yes.
Thank you, Ganesh. According to homeopathy, angle of treatment, there are 3 angles of treatment. Acute angle, miasmatical angle, and pathological angle. So, acute angle, acute diseases, according to symptomological angle, functional disease, yeah, according to symptomological angle, treat the acute disease. And chronic diseases, uterus, thyroid, yeah, any other disease, female genital organs, infertility. So chronic diseases treat according to miasmatical angle. Miasmatical angle is the best role of cure the patient. And 3 pathological angle. It is very difficult angle. लेकिन miasmatical angle beautiful treatment. Miasmatical angle, sora, psychotic and syphilitic. Madam deals की sora और psychotic depend the dysmenorrhoea. So psychotic, so according to homeopathic, king of antisoric remedy, 4+3+, sulfur. Sulfur is the king of antisoric remedy. Queen of antisoric remedy, sorinum. Sorinum. Queen of antisoric remedy, sorinum, is the best remedy. And king of antisyphilitic remedy, puja. And queen of antipsychotic remedy, syphilnum. Then king of antisyphilitic remedy, Marxol. The queen of antisyphilitic remedy, syphilnum. So intercurrent remedy, curative way of treatment. Presentation case, sulfur, then pulsatilla. Without sulfur, not curative. Sulfur, background of sulfur, any type of disease and any type of symptom. Main cause according to sulfur, sori. Sorai, mother of all diseases. Without sora treatment, not possible. All medicine, miasmatic. 1+, 2+, 3+. All medicine. Lekin sulfur is the best remedy in background of curative way of treatment, and puja is the best remedy background of curative way of treatment. Marxol is the best remedy background of curative way. Thank you, Dr. Raneji. Thank you, Rama. Please.
Anyway, Ram Parisar has added some more points to this session. It's really good. Doctor, how will you manage the acute exasperation of the symptoms of dysmenorrhea?
Dysmenorrhea, sir.
Yes.
Yeah, first, again, we have to consider the whole case. Treating based mainly on the individualization of the case. We have to consider the miasmatic background. And accordingly, we have to treat. Constitutional remedy will be given. Then in between, intercurrent remedy will be given. Finally, the cure is seen.
Definitely. Once you achieve the cure, everything will be there naturally. So I think we have some 3 more minutes. Ambadi madam, want to speak? Want to suggest anything to Dr. Ramya?
Very nice presentation, and let you will have very good practice in Qatar. That is sure.
Thank you.
Okay, you have
Okay.
got that flow. What is that treatment? That ability to do.
Those who practices homeopathy as per the direction given by Dr. Henman will definitely survive.
Sure.
What, this is what, am I right, madam?
Sure.
Yes. So it is that we have just 3 minutes remaining, and Dr. no, Abdul Salam sir is there to say vote of thanks also. Badi madam, what is your first prescription when a girl is brought to you with a severe menstrual colic?
To me,
Yes.
I will ask the nature of flow, as well as the nature of flow, as well as occurrence. If it is delayed, we will give medicine different, and if it is in correct time, we will give other medicines. Usually, it will be spasmodic medicines. It will be spasmodic pain. As palliative, you will give some medicine. Then
That's
only we will give the
we used
medicine.
to, we used to say that the chronic medicine shall not be given to a patient during menstruation.
Yeah,
Uh,
first we should give palliative medicine, and then only then if you are giving a constitutional medicine, it should be given after the flow of menses.
Cessation of the menses. Okay.
Yeah, cessation of menses. Then only we
Okay.
should give.
Okay. Thank you,
Okay.
madam. I'm ready, madam. And now I invite Sri Abdul Salam sir, who is behind this session. So you can say a vote of thanks to Dr. Ramya. Yes. Yeah.
Hello,
Yes, we can hear you.
hear me okay? On
Yes.
behalf of IFPH, I would like to express my gratitude to Dr. Ramya and all our well wishers today. Thank you.
Thank you,
Okay.
sir.
Okay. Thank you, Sri Abdul Salam sir. And thank you all for joining this session. Thank you, Dr. Ramya Girish. And tomorrow we will have a session from Dr. Najib. He will be talking about functional medicine. So with that, we come to the end of the day 1397. Thank you all and good night.
Thank you, sir.